OsseoSpeed modified the tire blast surface by allowing the incorporation of fluoride ions into the titanium blasted medium, which was achieved through etching using hydrofluoric acid. And in numerous studies, it was shown well over a decade ago now that this allowed for a more rapid osseoconduction to the implant surface. So we were getting a higher rate of bone conduction in a shorter time with an increased bone to implant contact. Hence the tagline, more bone, more rapidly. However, it's taken until now really for someone to consider the possibility that perhaps we were overdue for a meta-analysis and systematic review of the 3 premium implant surfaces on the market. And these kinds of studies are always very time-consuming and tedious. And so during COVID lockdown, I took to the task of looking at the influence of implant surface on maintenance of marginal bone levels for these 3 premium brand implants, those or surfaces, those being TiUnite, SLA or SL Active, and OsseoSpeed. And the results were really quite impressive. All 3 surfaces within reason lost less than 1 millimeter of bone, except at the 5-year follow-up for TiUnite. But there was a highly significant difference between OsseoSpeed, TiUnite, and SLA, SL Active, with the OsseoSpeed surface demonstrating an incredibly stable bone level over 5 years and a significantly lower bone loss at both timeframes. But perhaps what was more staggering was to look at the standard error of mean. When you looked at the mean values from the various studies in this meta-analysis, you can see on these scatter plots that there was quite a significant deviation between studies for TiUnite and a moderate deviation for SLA, SL Active. Yet for OsseoSpeed, study after study after study from clinic after clinic after clinic in all parts of the world came up with almost identical results. So OsseoSpeed, it seems, was hitting the bullseye every time. And when one compares OsseoSpeed to the other 2, you can really appreciate the high predictability, which should translate to increased safety and confidence for both the clinician and the patient.